Today we're going to cover Chapter 8 and Chapter 9 within one lesson. And this will cover adolescents, young adults, adults, and older adults. Here are the chapter objectives for Chapter 8. Adolescence begins at age 10, or around the start of puberty, and young adults are considered up to age 24. After 24, you're considered an adult, which is from age 25 to 64. The years between 10 and 64 are some of the most productive years of people's lives. You're attending school, you're starting your family, and all the way through your career until retirement, typically. And most enjoy the best health of their lives during this period. It also shapes the health. You also shape your health through your lifestyle and health behavior for the later years. So if you live your adult life as a healthy individual, you'll most likely have a healthier older adult life. Adolescents and young adults represent the future of our nation. And adolescence is a difficult stage. It is a period of transition from childhood to adulthood. Right? Most of you will be in this stage currently. And the comfort and security that we grew up with changes to complex and challenging situations. College itself is one of these challenging situations. Young adults also complete their physical growth during this period and experience multiple significant life changes. This could include leaving the home, changing locations, beginning a job, graduating college, going to college, etc. And many health beliefs, attitudes, and behaviors are adopted during this time and challenged. So depending on where you're from, if you came from out of state to Ole Miss, you might have had some abrupt changes in environment and culture, right? Or even if you're from Mississippi and you came to a bigger school where you're exposed to more people, you might have had some of your beliefs challenged. So the number of adolescents and young adults. In 2010, over 1/5 of the U.S. population was between the age of 10 and 24. In 2012, about half of adolescents were non-Hispanic whites. And as far as living arrangements, in 2012, more than a quarter lived in single-parent families, and there are a lot of variations by race and ethnicity. It's not consistent across race. We're also going to talk about employment status and healthcare access. So the number of young adults and adolescents in the labor force has remained fairly constant in recent decades. So it's not really increasing or decreasing. But there are disparities by race and ethnicity. And employment status has an impact on access to health insurance and health care. For the mortality, there has been a significant decline in death rates over the past several decades, mostly due to advances in medicine and to injury and disease prevention. Right, just think of the seatbelt like we talked about with in regards to child health. And the male mortality rate is higher than the female mortality rate. And again, this is not surprising because most of the accidents, or most of the deaths are from accidents, right? Men tend to participate more in risky behaviors than females do. And again, most of these threats stem from behavior rather than disease. Okay, so 41% of young adult mortalities are from unintentional injuries. This could be some kind of accident, homicide, 17%, and suicide, 15%. And there are significant disparities among race and leading cause of death. So here we have a graph of the death rates for leading causes of death for ages, and we have the leading causes of death in different colors. And if you notice on the left, the y-axis, we have deaths per 100,000 in the population. So this is a rate, right? Death rates. So if we look at the blue one with the circle, the top one, we have motor vehicle related injuries. So they increased from 1950 to 1980, and then we had a steady, sharp decrease. Okay? In homicide, we had an increase from 1950 to 1990, and then again we've had another decrease. Suicide has risen and is starting to taper a little bit. Cancer has slowly decreased, and heart disease has also slowly decreased. Now in terms of morbidity, right, or diseases, the main communicable diseases that young adult and adolescents contract are most of the diseases young adults and adolescents contract are communicable diseases. So, for example, the measles, which is pretty under control, right? And it's important to get these immunizations to maintain this low level. We also have to worry about sexually transmitted diseases in this age group. And this age group acquires almost half of all of the new STDs in the United States. Okay, that's a staggering difference. Okay, so this is a very serious age disparity. And some of the effects of STD complications can last a lifetime, like pelvic inflammatory disease. So here we have the number of reported cases and incidence rates of selected communicable diseases among 15 to 24-year-olds. And again, this is considered a young adult. Okay. So in 1981, you can see that there were high rates of gonorrhea, and it has decreased over the years. And in terms of measles, we've also had a drastic decrease, but you can see in 1990 there was a sharp increase. Okay. And in tuberculosis, we've also been decreasing. In syphilis, we had an increase, and then a decrease, and then another increase. So some of the health behaviors of high school students specifically include unintentional injuries, violence, tobacco, alcohol and other drugs, sexual behaviors like unintended pregnancies and STDs, physical activity and sedentary behaviors, and being overweight and controlling your weight. Some of the health behaviors of college students we need to keep an eye out for are unintentional injuries. A lot of this is related to alcohol use, violence, tobacco use, alcohol and other drugs, and again, sexual behaviors. So some of the protective factors that you should take note of when talking about adolescents and young adults are individual or environmental characteristics, conditions or behaviors that reduce the effects of stressful life events and increase the ability to avoid risk or hazards and promote social and emotional competence. Okay, so some of these examples could include school connectedness, right? So let's just consider the university, since we're all I know we're all in the university right now, right? So how related, how connected to the school do you feel, right? Do you feel like you're a valuable member? Do you value the groups you're in, the friends you have? Do you value the mission of the school, right? And how connected do you feel? Because if you don't feel very connected, that can be a risk factor for participating in these risky behaviors. Now, some community health strategies. So one of the main factors affecting community health in age groups are social and cultural factors and community organizing. And alcohol use is one of the main problems. So again, adults are considered to be adults when they're between 25 years old and 64 years old. And adults represent more than half of the U.S. population. When we talk about mortality, their deaths are mostly from chronic diseases, so things you develop over a long period of time. Whereas if you remember, young adults, mostly from communicable diseases or accidents. Okay, so many of these mortalities are associated with unhealthy behaviors and poor lifestyle choices. So anytime we talk about lifestyle choices, you should think about how the person eats. Do they eat a healthy diet? What type of risky behaviors do they participate in? Do they smoke? Do they drink? Do they do other drugs? Okay. Do they take precautions? Do they exercise, etc.? Okay. So lifestyle improvements and public health advances have led to a decline in the death rates for adults. So here we have some death rates for adults aged 25 to 34 and 35 to 44 in 2013, and it's grouped by white, non-Hispanic, Black, and Hispanic. So you can see that there are some disparities. So for the non-Hispanic white, 25-year-old to 34-year-old, if we look at unintentional injuries, the rate per 100,000 is 46. If we look at the same age group for non-Hispanic Black, we have 30.6, which is a decrease. And then if we look at Hispanic, we have 25.1. So less Hispanics aged 25 to 34 died from unintentional injuries than blacks or whites in that year. Here we have the same rates for adults aged 45 to 54 and 55 to 64. So cancer is the #1 cause of death for adults 45 to 54 and 55 to 64. Now, the specific types of cancer depend on which gender you are. So males, the main concern is prostate cancer, lung, and colorectal cancer. And for females, the main worry is breast cancer, followed by lung and colorectal cancer. Cardiovascular disease is the second biggest cause of death in the United States. Right now, I believe it is the main cause of death. Right? Cancer and heart disease sometimes go back and forth. So the age-adjusted mortality rates, right, meaning we controlled for how old the people are, have dropped over the past 60 years. And again, this is mostly due to public health efforts, right? What we're doing as a nation, as states, and as local areas. So we've increased smoking cessation, meaning less people are smoking, right? We're on a steady decrease. We've increased physical activity and increased nutrition quality. And this is not to say that we are in a good place as a nation, but we are getting better. Some other health behaviors that are risk factors for chronic disease include smoking, lack of exercise, one's BMI, and alcohol. Now, as of right now in the United States, 70% of adults are overweight or obese. Okay, so the BMI is high in the United States. And then we also have awareness and screening of certain conditions. So you routinely get checked for hypertension when you go to the doctors, right? You almost always get your blood pressure checked. And then we're also screening for diabetes and cholesterol more often because they are such problems in the US. Some of the community health strategies you can take, right? So we have to focus on the role of the individual behavior, right? What can you do to prevent most of these diseases? Because as a young adult, it's mostly your lifestyle, right? What kind of social factors should we pay attention to, environmental factors, and previous influences on your health across your lifespan. Okay? So a lot of what we learn how to live, like how to eat, how to exercise, we learn from our families. Okay? And then we also need to focus on primary, secondary, and tertiary prevention efforts for adults. So primary prevention would be something that focuses on complete prevention, right? Like we don't want to ever develop diabetes, so we want to control our blood sugar, we want to eat a healthy diet, right? So you can think of this as programs to get people involved before it becomes an issue. Now, a secondary prevention effort is when you get screened for the issue. Okay, so self and clinical screenings to identify and control disease processes. So if you want to stick with diabetes as our example, for secondary prevention, you would get routinely checked for diabetes. Okay? And then finally, tertiary prevention is considered like rehabilitation, right? So at this point, you have diabetes. The thing we do now is like we keep you going to the doctors, we keep you getting checked, and we help you control your diabetes. Okay, so again, primary is total prevention. We want to make sure you never get it. Secondary is we want to keep checking for it. And third is you already have it, now we want to treat it. So here are some discussion questions for Chapter 8. What are lifestyle and health behaviors significant? Why are lifestyle and health behaviors significant for the adult age group compared to other age groups? And how can community health efforts affect leading cause of death for the adolescent and young adult age group? So now we're going to go over Chapter 9, which focuses specifically on older adults. Here are the chapter objectives. Okay, so the number of older adults and their proportion in the total population has increased significantly in the 20th and early 21st century. Okay, so the sheer number of older adults and the amount compared to the entire population has increased. Right now, older adults represent 13% of the population, So 1 out of every 8 Americans is an older adult. Now there are 3 subgroups of older adults. You have young old, which is 65 to 74, middle old, 75 to 84, and old, which is above 85. So in case you're not aware, the average life expectancy in the United States is in the mid-70s, depending on your gender. Okay, so old being over 85 is as high as we'll get in the classification. So one of the issues with growing older is ageism. Now, ageism is a prejudice and discrimination against older adults. And some of these common myths are not accurate representations of older adults. So in reality, right, majority of older adults today are active and well. Okay, many of them are still working, and many of them are still very engaged in the community. This could be through volunteering and advocacy programs. So the size and growth of the older population has increased drastically, as we've already said, right? So older adult population is projected to continue growing, and this is part due to the baby boomer generation. So being 85 plus is the fastest growing segment of older people. Here's the projected resident population of the United States. Okay. You can see that under 5 is at the very bottom, and then up to 100 and over is at the very top. Most of the population falls towards 40 to 44, and then it tapers off on both sides. This is the projected resident population of the United States in the year 2050. So we think people will continue to live older due to medical advances, and so the sharp decrease at the very top has widened a little bit. Some of the factors affecting population size and age are the fertility rates. Again, the baby boomers were a generation where lots of babies were made, right? And the mortality rates, life expectancy, has continued to increase significantly in the 20th century, again, due to medical advances, right? Think back to our very first lesson, right? We've increased medical advances, we're more sanitary, we have lots of access to food, we have perhaps too much access to food, etc. Now, the dependency ratio is defined as the economically unproductive to economically productive people. Okay? So it's traditionally defined by age, and it can be used for social policy decision making. Okay? So the number of economically unproductive people to the economically productive people. The labor force ratio is the number of people actually working and those who are not working, and this is independent of age. Okay, so dependency ratio depends on age, labor force ratio does not. And the ratio of workers to dependents will be lower in the future than today. Here's the list of dependency ratios for the United States from 2010 to 2050. You can see in 2030, 40, and 50, it's projected to stay pretty similar for the old age dependency and have a slight increase for the youth dependency. Other demographic variables that affect community health programs for older Americans include marital status, living arrangements, racial and ethnic composition, geographic distribution, economic status, education, and housing. And we're going to go over those right now. So almost 3/4 of older men are married, and just over half of older women are married. Older women are 3 times more likely to be widowed than men, and that is because women tend to live longer lives. The number of divorced older adults continues to rise, and some new concerns along with that are lack of retirement benefits, insurance, and lower net worth assets. So similar to our previous week, we need to consider that getting divorced is not innately a negative outcome, right? We want people that are in unhappy marriages to be happy, right? And if divorce is the method through which that needs to be done, then divorce is a positive outcome. The only thing we need to worry about with being An older adult is making sure that you have the retirement benefits you need as an individual versus when you were married. In terms of living arrangements, the amount of living arrangements is closely linked to income, health status, and availability of caregivers, right? So if you're an older adult, do you have enough money saved? Are you well enough to live alone? And if you're not well enough, do you have anybody that can take care of you? So over half of non-institutionalized older adults live with someone else. And women are actually more likely to live alone than men, and again, that's due to, on average, healthier outcomes, and they live longer. Only about 3% of older adults live in nursing homes, but 3/4 of those in nursing homes are women, and more than half of nursing home residents are 85 or older, which is old. The U.S. older population is growing more diverse. In 2013, about 78% were white, 8% were African American, 7% were Hispanic, and about 4% were Asian. In the coming decades, the percentage of white older adults will decline, and older Americans of Hispanic origin will become the largest minority group in the U.S. More than 60% of older adults live in 13 states, including California, Texas, Florida, New York, Pennsylvania, Ohio, Illinois, etc. And California holds the greatest number of older adults, right? California has a very large population, but Florida has the greatest proportion of older adults compared to the rest of the population. The reasons that some states age or have older populations is because of inward migration, and we have young people leaving certain states. About 81% of older adults aged 65 plus live in metropolitan areas. In 1970, 25% of older adults lived in poverty, and in 2013, only 9.5% of older adults live in poverty. So we have had a decrease, and part of this is due to Social Security advances. So major sources of income for older adults are Social Security, which as long as you meet the minimum requirements, work a certain amount throughout your life that you'll receive. Income from assets, private pensions, government employee pensions, and earnings or savings. The percent of older adults who have completed high school has continuously increased from 28% in 1970 to 84% in 2014. And that's a pretty sharp increase for such a short time span. And about 25% of older adults had a bachelor's degree or higher in 2014, although there are differences by race and ethnicity. The baby boomers are the most educated cohort in the United States history as of now. In terms of housing, most older adults live in adequate, affordable housing. About 81% own their house and 19% rent. Older adults' homes tend to be older, of lower value, and in greater need of repairs than the homes of younger counterparts. And for most older adults, housing represents an asset. In terms of health profile, the health status of older adults has continuously improved over the years. They're living longer and more functionally healthy lives. They're able to walk, do what they need to do, shower, cook longer. And the chronically disabled has been decreasing. The health status is usually not as good as younger counterparts, which isn't surprising. The top causes of death for older adults are heart disease, cancer, stroke, and Alzheimer's disease. The activity limitations are increasing with age, right? So the older you get, the less you can move around, or the less you're able to move around independently. And some chronic conditions can be a substantial burden on health and economic status of individuals, families, and the nation, right? So if an older adult can't afford their medical bills or to get the care they need, right, that burden is usually pushed onto the family. And if not the family, then like Medicaid or something like that. And some impairments are very prevalent in older adults, and these could be sensory, physical, or have to do with cognitive function like memory. So generally, older adults have more favorable health behaviors than younger counterparts. So it doesn't mean they're more healthy overall, but they participate less in risky behaviors. So they're less likely to consume large amounts of alcohol, they're less likely to smoke cigarettes, and to be overweight. Now, there are a lot of areas for improvement, and this includes being more physically active and maintaining proper immunizations. So for physical activity, older adults are the least physically active of any age group, and that is not saying much for the United States. Right? The loss of physical fitness due to aging and chronic conditions is pretty severe. It can be challenging to overcome. Physical activity recommendations for older adults are the same as other adults, but only about 11% of older adults meet the physical activity guidelines. And without the ability to be physically active, right, the amount of time they have to be functionally active is going to decrease. So the longer you stay physically active, the longer you can take care of yourself typically. In terms of nutrition, some dietary concerns for older adults include reduced sodium intake, reduced caloric needs, increased vegetable consumption, and increased water consumption. Now this is pretty similar for the rest of the age groups in the United States. The number of obese older adults has increased and will continue to increase based on statistics. In 2010, 38% of those over 65 were obese. Only about 26% of older adults are in the healthy weight range. Just over 9% of older adults are cigarette smokers, and this number has decreased significantly over the past few decades. But one special concern of older adults are those who have been former smokers. Right? So although smoking, or when you stop smoking, the consequences taper off after a while. But if you've only recently quit smoking, you might still have some serious consequences you'll have to deal with as an older adult. In terms of vaccinations, so immune systems weaken with age, right? We know this, so it's important to keep up on your immunizations. So in 2014 to 15, that flu season, almost 70% of older adults received their flu vaccination, and that's really impressive, but we needed to get it higher, right? So vaccination rates have increased over time, but there are still some racial disparities. Another concern is the mistreatment of older adults. This is a particular concern if older adults are institutionalized or they live in a nursing home. So these reports have increased greatly in recent years, and mistreatment includes a vast variety of things. Right? It could be neglect, it could be physical abuse, emotional abuse. All 50 states have set up reporting systems to report these cases, but some of the special problems include those with dementia or cognitive impairment that might not be able to report it themselves, right? They might not understand what's happening. If someone's had a past experience with domestic violence, that could be an issue because older adults are typically frail, right? And a lot of them are socially isolated. They might not have a lot of family to rely on, if family at all, or friends or peers. There are 6 instrumental needs that determine lifestyle for people of all ages. The aging process can alter needs in unpredictable ways, right? If something happens, it'll change the amount of needs or the needs that are needed, okay? So the 6 needs are income, housing, personal care, healthcare, transportation, and community facilities and services. In terms of income, the changes in types of expenses and there's a change in types of expenses in elder years. Okay, so you have a great shift of how you spend money. Okay? And achieving older adult status often reduces income needs. You can live on less. You're typically doing less. Right? And income has improved significantly in recent years. And again, that's mostly due to Social Security. Unmarried women and minorities have the highest rates of poverty in older adults. Another need is housing. So it needs to be appropriate, right? It has to be accessible, adequate, and affordable. Now, accessible is one people tend to forget about. And if you're an older adult, you don't typically want to live in a house with a lot of stairs where you need to climb 3 stories to get home every day, right? You want it to be accessible as possible. And changing where you live as an older adult can have negative effects. Right? It can cause emotional distress, confusion, especially if they have any type of mild cognitive impairment. And there are a variety of housing options available. Right? If you're able, you can live alone. You can get assisted living. You can join a retirement community, enter a nursing home, or live in affordable housing. For personal care, there are 4 levels of tasks that may need assistance. This could be instrumental tasks, like what we are discussing now, expressive tasks, cognitive tasks, and tasks of daily living. So activities of daily living could be any type of functional thing you do all day. So it could be cooking, showering, going to the bathroom, etc. Now, instrumental activities of daily living measure more complex tasks, such as paying your bills, preparing meals, etc. In terms of caregivers for older adults, there can be an increasing number of problems. So there's an increased financial burden when you have to take someone in, a lack of privacy, and it demands a lot of time and energy from you. There are programs that can help with this, such as the National Family Caregiver Support Program, and support for working caregivers is a growing concern. Right? Older adults are the heaviest users of healthcare services because healthcare services increase with age. Right? You need to go to the doctor or the hospital more often the older you get. The most money spent in healthcare is in the last years of life. Medicare is the primary source of payment for healthcare services of older adults, but we will hopefully see major changes in future years. Transportation allows older adults to remain independent, so the greatest influence on if they are able to meet their transportation needs is the amount of income they have and their health status. Because public transportation, although more affordable, can be more challenging if you're older. So we need some solutions for transportation needs of older adults. We have community facilities and services, which is the last instrumental need. So Older Americans Act of 1965 was developed to increase services and protect the rights of older adults. So they developed a national nutrition program, the State Department of Aging and area agencies on aging, and some other programs. Now, these services vary greatly across the country, especially depending on which state you live in. Some other community services that are typically offered for older adults are meal services, where they bring you 2 meals a day typically, or 1 big meal a day. Homemaker service, chore and home maintenance. Visitor service, where someone just comes sits with you for a little bit. Adult daycare, respite care. This is where if you are a caregiver or you have a caregiver, they can come replace you for a little bit. Home health care, senior centers, and other services. So that's the end of chapter 9. Here are some discussion questions to think about. What can happen to increase the likelihood of older adults utilizing community facilities and services? How will the changing demographics of older adults affect healthcare services?